The endocrine system. In the skull, hypothalamus, pituitary. There's two parts to the pituitary. We'll talk about the anterior pituitary and the posterior pituitary. Both components of the pituitary gland produce hormones, and we need to know the hormones that are produced by the anterior pituitary and the posterior pituitary and their effect on other organs in the body. The thyroid gland is an important endocrine organ. The adrenal glands, the pancreas, the ovaries in the female, and the testes in the male. We'll also pick up the pineal gland and the parathyroid glands as part of this system. And we'll talk a little bit about hormones that you need to know that are secreted but are not considered part of the primary endocrine organ system. To review, and now this is familiar to you because we talked about negative feedback when we talked about enzymes in biochemistry. And once again, you see the familiar pathway. The hypothalamus in the endocrine system produces what we call releasing hormones. They're not as hard to remember as you might think because in the name is releasing hormone. So if you see a hormone like gonadotropin releasing hormone, alerts you to the fact that the source of that hormone is the hypothalamus. The pituitary gland makes several hormones that we need to know. Notice the hypothalamus, the relationship between the hypothalamus and the pituitary gland. So there's a stalk which connects the hypothalamus and the pituitary gland, and we'll talk a little bit about why that's important. Then we have hormones that are secreted by both the anterior and posterior pituitary gland, which will stimulate an endocrine organ which is downstream in the pathway, and that is, for example, the thyroid gland or the adrenal gland. Each of these glands will produce hormones that will move throughout the circulation and will activate target tissues. In some cases, hormones can be inhibitory, but most of the hormones that we will talk about will stimulate other peripheral tissues. For example, we have thyroid releasing hormone, and this releasing hormone activates the release of TSH. TSH is thyroid stimulating hormone. Thyroid stimulating hormone will stimulate the thyroid gland, and the thyroid gland will make T3 and T4, the two thyroid hormones that we will study in terms of the system effects. T3 and T4 that are secreted from the thyroid gland will affect other tissues, muscle tissues, tissues for growth throughout the body, skin, muscle. An additional releasing hormone, CRH. A lot of the releasing hormones are known by their abbreviations. Even when you see them in the chart, annotate them as CRH. That's a universal. The names are long. It is more practical to abbreviate them so we know these abbreviations. And if you see them on the exam, you should recognize what TRH is, what CRH is. CRH is corticotropin releasing hormone. GnRH is gonadotropin releasing hormone. So we'll have a list, but I just want to introduce you to examples. You also notice that the name suggests the organ that is going to be affected. So corticotropin suggests that it's going to affect the adrenal gland, and it does through its action on the pituitary. GnRH is called gonadotropin releasing hormone. So that suggests that that's going to be involved in activation, stimulation of the gonad organs. And in fact, it does. So the name suggests the organ that's going to be affected. That is also true for hormones that are secreted from the pituitary gland. So TSH in the name is thyroid stimulating hormone. So that's going to affect the thyroid gland. ACTH is adrenocorticotropin hormone. Very long name. That's ACTH. As the name would suggest, code suggests cortisol. This is going to affect the adrenal gland. FSH and LH, this is follicle stimulating hormone. LH is luteinizing hormone. Then we have the hormone that is produced by the gland itself. We need to know these. So many of them are probably already familiar to you. The ovaries produce estrogen, the testes produce androgen, but we're going to add some that are less familiar to us. like inhibin, which is secreted by both testes and the ovaries. The ovaries also produce progestins. The adrenal cortex produces glucocorticoids, and as I mentioned, thyroid hormones are produced by the thyroid gland. Now, how are hormones released? Hormones are released and controlled by three primary mechanisms: neuronal mechanisms, hormonal mechanisms, other hormones, and then humoral, circulating substances within the bloodstream that increase or decrease the hormone that's being produced. The release of hormones, as we talked about yesterday, is modified by feedback. And now we know what negative feedback is. We saw that pathway. So in negative feedback, we are decreasing the product at the end of the pathway. In positive feedback, we are increasing the product at the end of the pathway. It's important to know this distinction, and that is the difference between endocrine and exocrine glands. The difference between exocrine glands and endocrine glands are shown here. Endocrine glands, the secretion of an endocrine organ is directly into the bloodstream. All of these organs are vascular, meaning they have a capillary network which is throughout the organ. So when the cells of that organ secrete these hormones, the hormones will be secreted directly into the circulation. This picture, you see an example. It shows the cellular elements of the tissue. It shows a capillary network. And so when the cells secrete their hormones, the hormones are absorbed directly into the circulation and then throughout the body. The difference between this picture and this picture, the exocrine gland, these glands are typical of glands that we find on the surface of our skin. The ducts secrete directly into a channel, which will then secrete it to the level of the skin. So this is the difference between the two. So we want to point out that endocrine glands do not have ducts. They have a vast capillary network. The secretions are quote unquote internal. Typically, these hormones will act at a distance. There are exceptions, and when we get to those exceptions, we'll point out some organs which can secrete and affect the organs in close proximity, but most of the hormones that are secreted by these endocrine organs will affect tissues that are distant from the organ itself.